Hello friends, today we are going to discuss about the general management of a person with pigmentation. So whenever a patient comes to me with the problem of pigmentation, my first and foremost priority is to take a proper history. Now in this history taking there are several things. Sometimes it is very clear that why the person may have a pigmentation, like in the cases of acne. It is very clear that it may be because of acne that the patient has got spots. But in some cases, it is very difficult to find out the root cause of the pigmentation. And unless we find out the basic cause of pigmentation, we will not be able to help that patient. So we have to find out the lifestyle of the patient, the occupation of the patient, and the medicines which they might be using. This is the most important single point in the management of a patient with pigmentation, because if we are able to find the cause, we can treat it. Otherwise, we are just randomly treating that patient. Then we will examine the patient. We need to find out whether the pigment is epidermal or dermal, that is, if it is superficial or deep. Superficial pigment is usually easily treatable, while the deeper pigment may take longer time or may not fade out properly. We may also need to get certain investigations done, like blood tests and wood lamp examination, and in certain cases a skin biopsy may also be required. Now the single most important aspect of management of pigmentation is use of sunscreen. Many patients come to me and they say that we do not go out in sun. We have hardly any sun exposure, so why should we use a sunscreen? Well, I would like to tell you that even if you are staying indoors, even if the day is cloudy, you have to use your sunscreen during all your waking hours. And the sunscreen should be not just applied once in the day. It has to be reapplied every 3 to 4 hours in a good amount. The second aspect of treatment is use of topical creams. Now the ingredients of these topical creams matter a lot. There are many over-the-counter preparations available which are triple combinations, usually containing hydroquinone, tretinoin and a steroid. These medicines will give you very good results in the short term, but in the long term they are a disaster to your skin. There are many safer skin lightening agents available like kojic acid, arbutin, licorice, tetracurcumin. So a dermatologist will guide you on the right kind of preparation which will help you. Then there are several effective treatments also available, like chemical peels. Several sessions of peels usually lighten the pigment to a great extent. There are some lasers like intense pulse light laser, Q-switched Nd:YAG laser and fractional laser. A few sessions of these lasers, depending on the kind of pigment we will choose and guide you, they can help you to a great extent to get an even toned skin. Platelet Rich Plasma, commonly known as vampire facelift, is also a very effective treatment which I have found very useful in my practice. So if you have any doubts or queries, you can ask your questions in the comment section and we will be happy to answer your queries. And my final message is that if you have any kind of pigmentation, do consult your dermatologist. He or she will be the right person to guide you. Thank you. Stay blessed.